What's up, guys? If you clicked on this video, you're probably wanting some help differentiating SIRS from sepsis, as well as MODS and DIC. So I'm going to walk you through that. Let's just get at it. So let's start with SIRS, your systemic inflammatory response syndrome. This is something that occurs with your body when it's undergoing systemic or body-wide inflammation, not infection necessarily, but inflammation. This can be from several different things, right? So it can be from an infection, but it could also be from a really large burn. If you're in a car accident and half your body gets burned, that could cause systemic inflammation. Severe anaphylaxis or allergic reactions can cause it. These are conditions where there's a dump of inflammatory chemicals into the bloodstream, whether that's histamine or interleukins or cytokines. Those all flow through the bloodstream and trigger cascades of significant inflammation throughout the entire body. When that happens, you develop SIRS, systemic inflammatory response syndrome. Now, if it is caused by an infection, then we call that sepsis, and it's a closely related cousin. Okay, so you can just remember the equation: SIRS plus infection equals sepsis. Simple. Now, SIRS or sepsis, if they continue to get worse, progress eventually down the spectrum to MODS. MODS, multiple organ dysfunction syndrome, is when you have multiple organs failing. Your kidneys are going out, your liver's going out, your heart's going out, whatever. Often you'll see some kidney involvement. So in that case, you're going to see elevated creatinine levels, you're going to see oliguria, or a reduced urine output, things like that. After MODS, if it continues to worsen, you're looking at death. So definitely not a favorable outcome. But so that's how those three go together. So we have SIRS, sepsis, and MODS. Okay. SIRS, by the way, you would recognize by those SIRS criteria. So elevated heart rates, elevated respiratory rate, temperature, things like that. Okay. If we're progressing all the way into a drop in blood pressure, now we're looking more at MODS rather than SIRS. So be able to differentiate those vital signs. Now, the last one is DIC, Disseminated Intravascular Coagulation. This is a complication of SIRS or sepsis, more common when sepsis is involved. DIC is a response to those systemically dumped out inflammatory chemicals like interleukins, tumor necrosis alpha, cytokines, all that. Excuse me. In response to that, your coagulation cascade gets activated, your platelets get activated, you get these fibrin clots, and you basically have microclots throughout your whole body. So much so that you use up all your material for clotting, and now you are bleeding kind of spontaneously. And so these patients might start spontaneously bleed from their gums, from their gingiva. Their IV sites might start to ooze and leak a little bit of blood. So if you see someone with SIRS or sepsis and you're starting to see signs of just bleeding, then you would be concerned for DIC. DIC is not a necessary step in the progression to MODS. It is a possible complication that may or may not happen. So we have SIRS that progresses to MODS. Sometimes DIC happens in the middle. If it's due to an infection, it is also called sepsis. I hope that helps.